law, and I'm going to treat you all as human beings. We have to remember that doctors are human beings, and how do we look after ourselves? As William Osler said, medicine is a science of uncertainty and an art of probability. Non-technical skills can be defined as a constellation of cognitive and social skills exhibited by individuals and teams needed to reduce error and improve human performance in complex systems. Patient safety improves when non-technical strategies, tools, and behaviors are combined with proficient medical skills. Now, what are the medico-legal implications of non-technical skills? Only 50% of surgical errors can be explained due to lack of technical skill. The other half is due to non-technical factors such as communication problems, as Veda has said, which constitute as high as 43%, and work overload, which is 33%. In a retrospective review of 258 closed malpractice claims, systems factors contributed to error in 82% of cases, and communication breakdown was responsible for 24%. Now, how did NTS come across? It was started by United Airlines in 1981. This was formulated as the aviation crew resource management, because there were a lot of air accidents, there were lots of maintenance issues in aircraft, and United Airlines did a complete survey, and they brought about this fact that it was not pilot error, but it was a lot of communication problems, maintenance factors of the airlines, etc. And that is how the cockpit resource management came into place. And in healthcare, after the 1990s, the significance of human factors in patient safety became more widely publicized. And Flint pioneered a behavioral marker system known as the anesthetist non-technical skills, ANTS, followed by the non-technical skills for surgeons. Now, NTS is most important for anesthesia, critical care, and surgery, and I think most of our branches come under all this, apart from maybe cosmetic surgery or dermatology or something like that, but otherwise all branches are covered under this. Now, basically, it is the human factors, which is social, cognitive, and personal resources, how you monitor the situation, how you make the decisions, how you take a leadership role, how you communicate, and here communication is within yourselves, and coordinate actions within the team. Now, this was a wonderful thing which was brought about, what are responsible for the performance shaping factors. Now, assumption that adequate training, experience, and motivation are enough to ensure successful performance. This was necessary but not sufficient, especially in healthcare. Performance shaping factors can be classified according to a clinical adaptation of James Reason's 3 buckets models, which is the self bucket, the context bucket, and the task bucket. I'll just go on to the next. Now, this is a very compressed slide, but it covers almost everything. If you look at the individual, the self, you have to look at your physical condition, the health, discomfort, fatigue, hunger, stress. All this affects your decision-making factors. Irritability, language barriers, your religious repercussions. Then coming to the team, your own team, whether it's a new team, whether it's an old team, because your performance depends on your team. Then your goals of the team, who is the leader of the team, how much do they bind the team together, how much is your communication within the team members. Then coming to the task, the complexity, urgency, novelty of the task, the judgment-based, whether it's skill-based, was there a warning, are there written instructions, the risks. Then coming to the patient, and you have to look at the age, fragility, pain level, comorbidities, legal competence, and compliance. Very, very important. The moment a patient comes to you and tells you, and patients are very smart, they come and tell you either that I am a lawyer or my relative is a lawyer, the first thing they tell you is that. So you have to have your antlers up and make sure all your documentation is right. Then the marital status, then religious beliefs. This again, we came across one case where a patient had a hemoglobin of 2 grams per cent and they refused to take any blood or blood products because they were Jehovah's Witnesses. Now, what do you do in such cases? So these also form important factors. Then your workplace. Is your location central? Is it in a very remote place? Are there equipment available? What is the lighting? What is the alarm system? What are the communication problems? multiple factors in your workplace. Then your organization, especially you find that nowadays with the corporate hospital, most of them are led by corporate MBAs, and they are worried about the amount of money they earn. They are not worried about the patients, they are not worried about the doctors. So you have to look at that. What is the management style? What is the strategic planning? What are the incident reporting? What are their quality assurance? What are their legal backups for you? And their bullying tactics. And a lot of these organizations, they bully the doctors that give numbers. So you have to look at all this because all this also affects your working. Then coming to the KNOTS framework, it is basically situational awareness, decision making, communication and teamwork, and leadership. We'll go on to each of these. Now this was explained by RCOG as the KNOTS skill taxonomy, which is situation awareness, which is gathering information, understanding information, projecting and anticipating future states. If I take up a gynae case itself, a patient has come to you with twin pregnancy into the labor room. As a resident, you are gathering information. Is she a primary? Is she a multi? Sorry. What is the period of gestation? Because accordingly your delivery time will depend. Then what is the positioning of the twins? All these is gathering information. Then you understand the information and then you project and anticipate future states. Is she going to deliver just now? Is she going to have a cesarean? So accordingly you manage all this. Like perception, comprehension, projection. These three comes in under situation awareness. Then is decision making. Considering the options, selecting and communicating the options, implementing and reviewing the decisions. Now considering options, the same patient is a 28-weeker twin pregnancy in early labor. So obviously you're going to make her go into, keep her under observation. You're not planning a delivery at that particular time. Then selecting and communicating the option. Now if suppose she was 36 or 37 weeks in active labor, then you will be preparing for a delivery. So after you have gathered the information, you're considering the option, then you select and communicate the option. You select and communicate to your seniors, to the patient herself, and to the patient's attendants. If you are in the labor room, whatever you are the leader of that team. If you're a senior resident, your consultant hasn't come in as yet. You gather the information, inform your consultant, inform the patient. Now implementing and reviewing the decision, you implement it for your awareness and you're just keeping her on a watch profile. Suppose she goes into active labor, you have to change your decision. So this reviewing the decision periodically comes in with every patient. Now in decision making, there is a sum of cognitive strategies to select the best option to reach an objective, evaluation, judicious choice and communication of the decision made, implementation and re-evaluation of the decision. Then decision based on orders and rules is where the operator follows a previously established protocol. Experts, the focus is on previous experiences, which saves time for developing rational abstractions. So you find if a senior doctor comes in and assesses the case, probably they'll be able to make decisions faster. Decision making may be degraded by fatigue. Then coming to communication and teamwork, it's been dealt with very wonderfully in the last presentation. It is all about exchanging information, establishing a shared understanding and coordinating the team activities. Now communication plays a pivotal role and team working, all teams are better. The SBAR format, the situation, background, assessment, response, is of use in transmitting critical information and is now commonplace everywhere. Stress has a profound impact on decision making and it causes a reduction in cognitive performance also. Then coming to leadership, setting and maintaining standards, supporting others and coping with pressure. All this plays a very important role. Effective leadership is essential for maintaining a safe performance in the workplace and maintaining morale. Now remember that every person is a leader at some stage or the other, from the youngest intern to the senior most consultant. In the labor room, even the intern who's there is the leader at that particular point as far as the nurses, the GDAs, all those are concerned. Leadership requires motivating, directing, and organizing the team, encouraging the individuals to work together, assessing performance, task assignment, and generating a positive environment. Leadership skills may also be needed by other members of the team when necessary to plan, prioritize, and manage the workload. And all this affects the workplace at that particular time. Now, what are the other non-technical skills? Maintaining dignity and a professional relationship with the patient when awake and vulnerable should be considered as a key NTS. Now, for example, a patient is, you're doing a cesarean section, patient is under spinal anesthesia. You have to remember that the patient is awake, alert, listening to what all you are saying. So it's very important that you're not joking about her scar or her abdomen or the baby or something like that. You can talk to the patient, you can be positive towards the patient, but please do not make fun of anyone over there. Don't scream at people over there, because all that affects the patient relationship with you. Then partner management, dealing with disruptive behavior. The partner of the patient or the relatives, how you deal with them, also affects your performance and affects their violent behavior also. Professional behavior, that is remaining calm under pressure, coping with distractions and interruptions, cross-monitoring of performance are also skills required across the specialty. Managing stress and fatigue. Now, empathy. This again, Vedas talked about in communication. It is the ability to share and understand the feeling of the other. This we've already talked about. Now, dramatics and doctors. As Shakespeare said, all the world's a stage and all the men and women are merely players. They have their exits and their entrances, and one man in his time plays many parts. Now, dramatics and doctors. I think doctors have to be the greatest dramatists. Emotional control and manipulation techniques are required to best cope with the psychological demands of patients. The strain of having to be always cheerful to the patient, even when you really want to wring their necks. Emotional labor on a daily basis to appear reasonable all around, no matter how ragged we are feeling, really. You may have a child who's ill at home, but you have to go there and deal with patients and with a smile on your face. Key emotional labor tasks are hide negative emotions and display positive emotions even when not there. Now, there is a great interdependence of all the non-technical skills. Good teamwork, good leadership, good communication, good situational awareness, all this leads to good decision making. And stress and fatigue affects all this. Remember this, you are human beings. So now what are the 10 important non-technical skills? First is empathy, then communication skills, be a team player, dealing with pressure, strong work ethics, positive mental attitude, flexibility, time management, self-confidence, and dealing with criticism. So to summarize, I'll say that non-technical skills are essential in complication management and crucial if confronted with litigation. Awareness of the complexity of the planned operation, theatre setup and equipment are important in preventing complications. Mental preparation of the surgeon is of utmost importance in order to be able to confront any problem. When complications occur, remain calm. Calling for assistance, effective team leadership, and harmony in the team are important in managing the situation. Good and effective communication with the patient and relatives, offering explanations, apologies, and timely interventions without delays reduces the risk of litigation and strengthens any defense in court. Thank you.
Can we have a big round of applause for the speakers, please? So, may I request the chairpersons to please felicitate the speakers? Dr. Krish, please. Dr. Bela, Dr. Chitra, Dr. Vitul, if I may have you on stage, please. interest of time, if I may ask the next panel to be to chair the session. Professor S.S. Pandov, is he here? Professor G.P. Thami. So are you here? Dr. J.P.S. Sodhi, are you here? Dr. Vikram Bharti. Dr. Alan Joseph, if you may please proceed to the stage. Dr. Bhanu Parmar, do we have him in attendance? Right. Right, thank you.
Good afternoon, ladies and gentlemen. So we are into the next session of this program, and I think we had some interesting talks already. I think the coming session